Welcome to Health Calls, the podcast of the Catholic Health Association of the United States. I'm your host, Brian Reardon, and with me in the same room this time is our executive producer, Josh Manica. Hey, Josh, good to see you not on the screen, but actually across from me.
Yeah, not across the hallway. Sorry to give you all a peek behind the curtain, but usually I'm just over in the other room.
So this episode, it's the final one of season 6, which our theme has been United for Change. And we're doing something different. I don't think we've done this in past seasons. We're going to actually do a clip show. We're going to go through, and we've identified 6 guests who we think had some insightful comments around what it means to be united for change as we work in Catholic healthcare to elevate human flourishing. Before we get to that part, though, I think we should mention the fact that we just had our assembly, which is our national gathering of leaders from across the country here in St. Louis last week. The theme was also United for Change. Share a little bit of the takeaways. That was, you had a big role in that. We both were helping organize and brought in members, but what were some of your takeaways from that meeting?
One of the things that I think about when we hear from members and attendees of assembly in the past, one of the big things that people talk about is the words family reunion get used a lot. There's kind of inspirational gathering aspect to it. And that certainly it felt like they were there. I think especially for us, since we all live in St. Louis, or most of us in CHA live in St. Louis, it was like welcoming people into our space and our city. But I would say the thing about this assembly that stood out to me was there was a really palpable sense of the change aspect of United for Change. I think everybody felt that like the coming together for something better and something new and exciting, and that yes, like in there was an inspiration in the work that we do, but there was also this sense that like we can do more and we can do better, and like we can do that when we're together. And I thought everybody from the keynotes, which were excellent this year, to all the award speeches, which were really excellent this year, really left everybody there with a sense of renewed purpose of like, okay, if we are together, if we are really united in our ministry, we can be an effector of change in the world, and specifically in the United States.
Yeah, and I think, the keynoters all kind of fit together. There was a message weave, whether it was former Surgeon General Adams, whether it was David Brooks, whether it was John O'Leary, or even the panel discussion with various church leaders, really about the sense that, again, together we're stronger, the sense of that human connection. I think David Brooks in particular, we had a lot of really great feedback on his presentation. And really, it was about making sure that, as we're working with other people, we're communicating, we have to take that time to be present and listen to people and see them for who they are. And he challenged, I think, people to say, do that, because a lot of times we aren't fully present. We're not listening actively. And so it was a good reminder. I think all of the presenters really, without necessarily being, prompted to talk about Catholic social teaching and how that sort of underpins everything we do. They all in their own ways, even Dr. Adams talking about the many challenges facing us, I think, raise up the fact that Catholic healthcare, if anybody's going to do it, it's going to be those of us who serve in Catholic healthcare to really make a change in how care is delivered in this country.
Yeah. And I mean, I think too, and part of this was intentional on the part of CHA and everybody who had a hand in choosing the keynoters, but they all came from it from a different perspective, right? Dr. Adams is a healthcare professional, and he's been a policy, maybe not maker, but like he's been involved in that world. John O'Leary was a patient at a Catholic hospital, and his life has been dramatically affected by care from Catholic caregivers. And David Brooks is kind of an outsider. He's like a commentator and an analyst, and he sees things from like a 10,000 foot view. And so he was able to come at from that perspective. And that variety of voices, I think, really echoed the type of unification that I think that we would like to see it at CHA. And I think I speak for a lot of people in Catholic healthcare that we want to see is like people from different perspectives, patients, frontline caregivers, executives, mission leaders, policymakers, advocates, like all coming together to do something bigger and better.
Well, let's dive into some of these clips. Again, throughout the season, we had John O'Leary is actually one of the guests, and it was good to hear him speak, kind of wrapping up sort of this United for Change theme. But we were really talking to different members in particular about the work that they're doing in their community. And so I think the first clip we're going to play is from Nicole Wilson. She's the Community Health and Housing System Manager at Common Spirit. And these next two guests that we're just going to hear from briefly really was about the power of listening to those we serve. And so I think that's, again, getting back to my comments about David Brooks and how challenging us. It really is important to hear deeply or listen deeply before we just jump to solutions.
I think it was a noticeable gap because we've all worked in the homelessness space, the folks that are on my internal team, for quite a few years. But the difference is we've never actually experienced going through any of the projects and programs. We might have provided direct services as service providers, but to actually know what it's like to situate oneself in a medical respite bed because you don't have any place to go post-discharge from the hospital, or to be engaged by a street medicine team, or to have the experience of experiencing homelessness with a pet and trying to find housing. Those are not experiences that we can speak to firsthand. And so when creating and crafting projects and programs that are trying to address those needs, we often go to our direct service providers who often have that same level of knowledge and expertise. But that missing piece is, what would it actually feel like to have felt safer in this project or programs? What are things that maybe are gaps that we're missing when we're trying to initially have these conversations? And I think it was just knowing what we didn't know was, I think, very, very much a part of why we felt it was important to engage individuals with lived experience in this process, because there is an acknowledgement that there is different levels of what it means to be professional and to be able to provide expertise, right? We hire consultants, we hire folks with PhDs and certain levels of education. And it's honoring the fact that this particular experience isn't something that you can be taught in school, but there's so much value in the expertise that our members provide, and being able to not only engage them in these conversations as colleagues, but also to be honoring that level of expertise that they're bringing to the table.
Yeah, I think I remember the story was put on to us by Valerie at CHW after she went and did a story out with Nicole and her team there. And I think what this is a reminder of is that the communities that we serve in this ministry are a part of the care continuum, right? It can be really easy to look at it from a case by case basis, but ultimately, if we want to adopt a healthcare system that is really caring for people across the phases of their life, not just when they come to our facilities, right? It's meeting them where they're at. And for a population like the unhoused, that's such a specific lived experience that I thought what Nicole and her team are doing by like really saying, we need those people in the room with us helping make decisions, because we cannot speak to that experience because all of the different things that go into it are so experience based. And so I thought it was a great reminder that not just with unhoused populations, but in all the community benefit work we do, and even in some of the more stuff inside the hospital, the acute care that we do, it's a reminder that people know their situations best, and to invite them to be a part of the decision-making process. And I think that was kind of a radical way to look at healthcare, because it's not top down necessarily. There's a term for it in Catholic social teaching that it's blanking. Yes. It's subsidiarity, which I think is a really cool and a really new way of looking at the way that people are
and her
cared
comment
for.
too about where you find expertise, I thought was, again, another good reminder that we, those who work in Catholic healthcare or healthcare in general often have advanced degrees, have a lot of expertise, go to school for a long time. But, just having a PhD doesn't necessarily always make you an expert. And so looking for that expertise and that lived experience, I think, was a really strong message. So the next clip we're going to play, again, on this theme of listening to those we serve, we also chatted with Megan Tim. She's Regional Director of Community Health for SSM Health in Wisconsin. And she talked about her work with the Parish Nurse Program. Let's give a listen.
We don't need to see the magic in the numbers when we can see the magic in the person and the outcomes for that person subjectively. We can go into that parish and say, we'd love to have a focus group to learn from you all. What do you think are the biggest health issues right now? And then that parish nurse will say, let's say fall prevention and isolation are the top two that come out of that conversation at the parish. Now that parish nurse is boots on the ground to say, I got you. We're going to have a fall prevention class here. And let's talk about what isolation means. Let's talk about how we connect more as a parish if we feel like there's some isolation happening with our older adults. And so they're really boots on the ground to employ what the community is telling us and meeting the needs right away. We don't have to wait. And so when they're built into a community health improvement plan, wow, you've just taken the one person responsible for that and deployed it across 4 other people to help carry out that work. What a gift.
Yeah, so I'm not new to Catholic healthcare. I've been in my role at CHA for about 4 or 5 years now. But Brian, you've spent a lot of your career in Catholic healthcare, so this concept of parish nursing was newer to me, and it's not as new to you. What about this conversation stood out to you, hearing about this type of program, specifically at SSM?
Yeah, I'm a big fan of the parish nursing program, and I'd like to see it done more. I think we do a lot of it across the country. And really, again, this when we talk about United for Change and being united with those in the church, this is really a wonderful model for how we engage local parishes. And if you think about the parish community, and not even a Catholic church, but just any church community, there's a lot of trust, and there's a ton of erosion of trust that we've seen, particularly since COVID. So I think having individuals who are known with their congregations in these communities that can be a trusted resource and be able to help steer people to the right care, I think is a wonderful model, and something that, again, speaks to our power collectively united as the Catholic Church, and what we can do, again, to promote healing among those we serve.
Yeah, and as we're talking about listening to those we serve, right? I think your point about trust is really well spoken, especially because, like, when I think about it, when I'm being cared for, I don't want to be cared for by just like this amalgamous system. I want to be cared for by a person. And so when you talk about, especially communities that like larger communities that may have lost trust in the healthcare system at all, like a parish nurse, someone who is in their parish, someone who they know and speak to on a regular basis, can really be a bridge builder in that way. And hopefully, on a larger scale, there are things we can do, but that can be a way to individually bring people back in to the fold of maybe I don't trust health care, but I can trust this person. And then over time, that trust can be redeveloped.
Yeah. And I think one community that there's a lot of erosion of trust, again, is among those who are immigrants, migrants in this country. So in this next section, we have 2 guests that were just wonderful. I'm not going to play favorites, but I really like the next 2 individuals that we're going to hear from. And really, in these couple of clips, we're really now shifting to raising our voice for those who are vulnerable, and particularly those who are migrants, those who are immigrants. And we just, we don't need to get into all of the changes that have happened over the last year or two with how this population basically is being demonized. So it was good to hear from both Sister Norma Pimentel. She was, I think, one of our first guests of the season. She's president and CEO of Catholic Charities of the Rio Grande Valley. Let's give a listen to what she had to say.
We should not allow ourselves to be guided by fear, but rather by God. God should be the force within us that pulls us forward, that allows us to be courageous, to live out our faith, to act with love. Because if we have anything, we don't have power to do many things, but we do have power to do one thing, and that is to love. And that nobody can take that away from us. We have to bring that out, because it is always what God would want us to do with everybody. We shouldn't look at our differences or who that person is, whether they're legal or not. I think we're not breaking any laws when we love, and so we must focus on that and trust that we're doing the right thing.
Yeah, Josh, I think we're both big fans of Sister Norma. What was your takeaway from her show?
Yeah, hard not to be a big fan of Sister Norma. And as a reminder, this was our first episode of this season. And we started, our relationship, CHAs, I should say, with Sister Norma goes beyond this. But I remember kind of the build up to this episode started at Assembly 2024 when she lent some artwork to our sacred space. And really that led into what she talked about a lot in this episode about the power of storytelling and as a way of bringing about change and hearing people's individual stories, right? Sister Norma is so enmeshed with this community of people who, despite their legal status, need care and are people made in the image of God, right? And so they should be afforded that dignity that entails. So I think hearing her talk about those stories of the people that she'd worked with, both in the episode and in our other conversations with her, and talking about how hearing those stories can really be a powerful emotional charge to bringing about change and changing hearts and minds toward this community and other communities that may be, like you said, demonized, I think was really, really powerful. And I think that Catholic social teaching specifically gives us an opportunity to have like a moral center.
No, she was great, and I think later in the season, then I think I'm trying to remember the conference that the bishops had where they came out with a statement on immigration. We thought, oh, okay, even though we covered the immigration issue, we thought it was important to revisit that later in the season, and so we brought in Bill Canny, who's executive director of the USCCB's Secretariat of Migration, to talk about their initiative. You Are Not Alone. Let's give a listen to Bill.
Immigrants who are fearful understand that they are not alone. I mean, largely, we also want to inculcate a greater compassion for the immigrant situation in this country and help people understand that the undocumented immigrant, if you will, is not just a product of their own action, but all of ours. The fact that we let them in legally into the country, that we did not adjudicate their presence due to a slow court system for 5, 10, 15 years. We allowed them to work. We paid them. We legally supported them with benefits, access to school. These folks are not in this situation on their own. We're all actually responsible.
Yeah. So Brian, I think what was really important to us as we started the season talking about United for Change is that a big part of that be our partnerships within the church. And when the USCCB put out that statement and really took a strong moral stance on this issue, yeah, we were like, that has to be part of our messaging here. So what stood out to you from our conversation with Bill?
Well, I think, and again, Bill had mentioned, and I think it's important that nobody's saying we don't need immigration laws, but I think the crux of this is really about human dignity. And there's got to be a way to do it that respects the dignity of individuals. And I think Bill did a very nice job articulating what the USCCB stance is, what the program is, and how they help migrant populations. And I think that is a role that the church has historically done. And it was just, I think, reassuring and inspiring that our bishops came together and made such a bold statement on this. And I think that's an area where both Catholic healthcare and leaders of the church across the country are very united in that this notion that we have to uphold the human dignity of every person, regardless of what their legal status is.
Yeah, I mean, I think we keep using the word unity and unification because, that was the theme of the season. But I think if there's one thing throughout the course of the season where I'm like, that's a picture of unity, it was the bishops in that moment. Like, they're coming out of that conference, their moral call was so clear. And it was like so confident. And I think that gave me a lot of confidence as someone working in Catholic healthcare to be like, okay, we're doing the right thing when we look to care for people and uphold their human dignity and that's our foundation of where we're working from. So I was really thankful that we got the chance to talk to him and hear him talk about how the USCCB is working in this area.
Well, and this last section, then we've got two more clips that we're going to play. And really, we wanted to focus in on this idea of how can we think differently and be open to new ideas as we seek solutions to elevating human flourishing. And one of the guests we had this was another prompt from one of our publications. Dr. Scott Neely from Common Spirit wrote an article for Health Progress that really jumped out at me as like, yeah, he gets it. Like, he gets this idea of really involving the community to seek solutions. And we talk a lot about community impact and community benefit and health needs assessments. And I think Dr. Neely really did, in both the article and our conversation with him, talked about this model. So let's give a listen to, again, Dr. Scott Neely. He's president and CEO of Dignity Health's Sierra Nevada Memorial Hospital.
I believe that this is an approach that can be broadly embraced across the country. I'm sure that the solutions are going to look different in different communities. One of the reasons that I was so interested in doing this in Nevada County is that I do see it as very fertile ground. It's a relatively small community. We're talking about approximately 100,000 people. And there already is a pretty strong appreciation for things like, outdoor life and activity and high quality food and, culture and community. So I think it is fertile ground, and I'm sure this would be a much different lift in an urban environment. But the fundamentals that we are talking about are very sound.
Yeah, and again, that was Dr. Scott Neely. We also wanted to play a clip in this Seeking Solutions segment of our recap episode from Lindsay Myers. She serves as Vice President of Communications, Public Relations, and Community Engagement for Avera Health. And what she talked about in the episode was food insecurity. And Josh, you actually had a chance to visit this work or experience this up in South Dakota.
Yeah, so myself and some of our video production partners at Once Films went up to Sioux Falls and got to visit Lindsay and her team to talk about this food pantry program. And the pantry program is wonderful. We're working on a video about it that I'm hoping to have out here soon. But I think what stood out to me most about her quote in her episode, which we'll hear from in a second, was that was there was a humility behind it, right? Because when I was there, they were about a year in and they had delivered so many bags of food. And the way Lindsay talked about it, she was like, look, we serve a large population as rural healthcare, and we can't do everything. So we understand that there are things that we have to partner with other people with that. And so that humility, but also that confidence of like, this is what we know we can do to serve this population, I thought was really, really cool. So I'll stop talking and I'll let Lindsay take it from here.
So Avera has about 37 hospitals in the upper Midwest, and over 90% of those are critical access hospitals. So I just want to share that, because when we talk about community health needs assessments, I mean, we're really talking about some of the most rural and remote areas of the United States. And so we do have a large tertiary center in Sioux Falls, and that's where some of our food insecurity work is happening, but we're really serving this broad footprint. And so when we were looking at our community health needs assessment and our social determinants of health over the last few years, we were seeing food insecurity rates rising. And I'm from a very small town. I'm from a town of 200 in South Dakota, so a very small area. It does not have a grocery store anymore and hasn't for years. And so access to fresh fruits and vegetables and just some of those basic human needs is not there. And so we have to meet that in unique needs or unique ways. So we have a program called Community Partnerships, which looks at the social determinants of health and really looks at how we can work with nonprofits, because healthcare, we can give the best care within our facilities. But when we turn people out into environments that have a lot of food insecurity or housing insecurity, lack of transportation, things like that, we're not really caring for our community holistically.
Yeah, Josh, what I liked about this conversation with Lindsay was really looking at the bigger picture of not just providing bags of food, but also, what are the transportation needs? How do you get clinicians involved in this? And I think that is really a common theme, maybe throughout all of the episodes we did this year, of really those partnerships working across different professions to really put the patient and the community at the center of what we do. So I think her comments, Dr. Neely's comments, both really spoke to that as we seek new solutions to helping elevate human flourishing. And so any final comments about the season?
This is something that you assume when you're in healthcare, but there is such a willingness amongst Catholic Health members, or I should say members of the Catholic Health Association, to think outside the box in terms of partnerships, right? Like I think about all the episodes that didn't make it onto this clip show just because we didn't have time. Like I think of Dr. Talker in Chicago and the work that he's doing for mental health needs for young people, and the way that he was like, there's a nonprofit here that's already doing this work. We should be working with them to expand their coverage. Or Dr. Rao, who is like, the data is out here that talks about like green space, and people are doing this. And her challenge of basically Catholic healthcare can be a leader in this way. And so Catholic Health Association members are willing to do that work. And I think, and what I hope, is that hearing their voices and hearing about these programs that are like really going outside of themselves or thinking differently about how they can bring other people into the work inspires our listeners to think about maybe how their systems can maybe tweak programs that they're doing or introduce new programs. I know it's hard with like finances, but we're all creative people, right? Like even if you don't have creative in your title, everybody's creative in some way. And so I think as we continue the work of Catholic healthcare, being creative about opening up to different partners, even within and outside of our system, to expand our horizons in the work that we do, I think is really encouraging. And I think coming out of this season, I'm just encouraged on how many people are willing to do that and the types of results that they're getting doing that.
Yeah, and I think you don't need to recreate the wheel, right? There's a lot of examples that in conversations we had over the season, Civic RX, Dispensary of Hope are two examples of programs that are up and running, and it's a matter of being, willing to participate. And I think we've actually heard from some people about their desire to look into those programs because they heard a conversation. So that's always sort of rewarding to know that these guests that we have on, they are having an impact with other Catholic health colleagues who might pick up an idea and say, hey, why won't we try this in our own ministry? So again, thanks for all your work. Thanks to Sarah Marchant for her work in helping schedule things. This is our final episode of Health Calls for season 6. We're going to be back in the fall, Josh, to talk about Health Reimagined. So we're, again, keeping to CHA's strategic plan. We'll have more guests from the membership, really looking at other new and different innovative ways. We've talked a lot about different partnerships, and some of those partnerships were innovative. We're also going to focus on a lot on the work we're doing in our communities to address community health and community impact. So look forward to being back in a couple of months with more episodes. Appreciate those who are listening and have been loyal listeners. And for Josh Matica, our executive producer, I'm the host, Brian Reardon. We appreciate you listening to Health Calls. Of course, you can hear all of our episodes. If you missed one, you can go to our website, chausa.org/podcast. You can also do the drop-down menu under news and publications, and there's the episodes all listed there. Health Calls is also available on all of your favorite podcast apps and on YouTube, and we'll be back with YouTube in the coming season as well. Health Calls is produced here at Once Studios in St. Louis. As always, thanks for listening.